Hi there. Are you feeling well rested today? We hope you are, because in today's video we'll be talking about sleep and how it decreases your risk of dementia. This video is part of a series on how to identify and reduce risk factors for dementia. Dementia is a general term for loss of memory, language, problem solving, and other thinking abilities that are severe enough to interfere with daily life. Alzheimer's disease and vascular dementia are two of the most common types of dementia. Sleep is essential to feeling good and staying healthy. Sleep problems can increase our chances of developing conditions such as depression, obesity, heart disease, diabetes, and cancer. In fact, lack of sleep can even shorten our lives. We all know that a good night's sleep can make us feel well rested, more alert, and give us enough energy to get through the day. But did you know that sleep is also important to keeping your brain healthy? That's right. Researchers have found that having problems with sleeping can increase your chances of developing dementia. Today, we will be talking about some common sleep problems and the things people can do to improve their sleep. Did you know that adults should get at least 7 hours of sleep every night? Unfortunately, 1/3 of adults get less than the recommended amount. Sleep problems are very common, and it is possible to have these problems without being aware of them. The two most common sleep problems are snoring and feeling tired throughout the day. Although it is difficult for you to know if you snore, being sleepy during the day is an indicator that you might be experiencing sleeping problems. Some sleep problems are diagnosed by a doctor. One example is insomnia, which is the difficulty of falling or staying asleep. Another problem is sleep apnea, which is when you stop breathing for a short period of time while sleeping. Brief, occasional pauses in breathing during a deep sleep are normal. However, longer and more frequent pauses in breathing can be concerning, as this can starve the brain of oxygen, which can put a strain on the heart. Almost 1 in 7 Canadians between the ages of 60 and 79 have sleep apnea, making it the most common sleep problem in older adults. Sleep apnea is much less common in those under age 60. About 1 in 25 people have it. Therefore, sleep apnea is something to be aware of as you age. It is important to be aware of sleep problems because having them can increase your risk of developing dementia. Here are a few things you should watch out for to help you determine if you are experiencing a sleeping problem. The inability to fall asleep or stay asleep is a sign that you might be experiencing insomnia. If you find that you are needing to gasp for air during sleep, or aren't feeling well rested when waking up, along with other symptoms, such as a dry mouth or sore throat, this could be an indication you might have sleep apnea. Most people take between 5 and 20 minutes to fall asleep. If you usually take more than 30 minutes to fall asleep, this is worth discussing with your doctor. Taking naps very often might be a sign that you may not be having good quality sleep. Taking naps throughout the day is an indicator that your body is feeling tired and needs more rest. Sleeping less than 4 or 5 hours per day may also indicate a problem. As we mentioned earlier, getting at least 7 hours of sleep is recommended. Anything less than this may result in an increased risk of health problems. Sleeping more than 10 hours every night. Yes, you heard that right. Sleeping more than 10 hours may be a sign of an underlying health problem. It's normal to feel tired occasionally. But if you are often feeling fatigued, it may be that you're either not getting a good night's sleep or not sleeping enough to stay awake throughout the day. Did you know that not getting enough sleep is related to health problems, such as dementia? That's right. Not getting enough sleep is related to a 25% greater risk of dementia, as well as milder, but still significant cognitive impairment. Also, those with dementia may struggle with sleep problems. These sleep problems can reduce their quality of life and cause them to become more agitated and confused. People with dementia who often have poor sleep are also more likely to have trouble keeping social relationships and have higher levels of depression and anxiety. Most people experience sleep problems every now and then. But if you notice that you are frequently having sleep problems, it is important that you talk to your doctor about how you can address these issues. You may be wondering, how do I know if I have a sleeping problem? The most accurate way to identify sleep problems is to participate in a sleep study, also called polysomnography, or PSG, under the care of a doctor who specializes in sleep medicine. Sleep studies are an efficient way to learn more about your body, as doctors are able to monitor your sleeping patterns in a lab to see how you breathe, how your heart beats, as well as measuring your brain waves overnight while you're asleep. Although not a substitute for a PSG test, wearing a fitness monitor while you're sleeping over multiple nights can provide some important information. You can also make your own sleep log to track when you go to sleep, how long it took you to fall asleep the previous night, and what time you woke up in the morning. Caregivers can help those with dementia by watching them sleep and noticing any problems such as snoring or waking up during the night. You can also connect your loved one with dementia with a doctor who can help them with their sleep problems. If you share a bedroom with a partner, observing your partner's sleep and noticing snoring or frequent pauses in their breathing while asleep can be indicative of sleep problems. Bringing these observations to your partner's attention can help motivate them to seek help from a doctor. Sleep problems can be treated through different lifestyle changes. Being exposed to light in the morning can help with sleep because it can help you feel more awake throughout the day. Going for a walk in the morning outside or buying a light therapy lamp can help. There are also strategies that you can do on your own to improve sleep. You can try having a regular nighttime routine. This means going to bed at the same time each night. Trying not to nap during the day. But if you do nap, do so for no more than 30 minutes every day. Napping for too long can make it hard to fall asleep at night. Minimizing alcohol, smoking, and caffeine, which is in coffee, tea, and chocolate, as these things can interfere with your sleep. For some people, eating dinner late at night can impact sleep as one's body may still be digesting food at bedtime. It is important to get enough exercise during the day. But avoid exercising within the hour before going to bed because it may make you feel more awake. Sleep in a dark room that is at a comfortable temperature for you. A cooler room temperature of approximately 15 to 20 degrees Celsius, 60 to 67 degrees Fahrenheit is recommended, and the room should be quiet. Do not use screens before going to bed. This includes putting away your phone and turning off your TV. It is best to be in a dimly lit room just before you get ready to go to bed. If you have insomnia, your doctor may recommend an effective intervention called cognitive behavior therapy that is specially focused on insomnia, also called CBTI. Trying relaxing techniques such as yoga, meditation, or other therapies before bed can also help with sleep difficulties. Talk to your doctor for recommendations if you have sleep apnea. The most common approaches to treat sleep apnea include a continuous positive airway pressure machine, called a CPAP machine, or a bilevel positive airway pressure machine, called a BPAP machine. For mild or moderate sleep apnea, your doctor may suggest a tongue retainer, which is an inexpensive device which is kept in the mouth while sleeping. This may prevent the tongue from falling back into the throat. It may take some time to get used to using devices such as a CPAP, BPAP, or tongue retainer to treat sleep apnea. If you are overweight or obese, weight loss may be helpful to decrease your sleep apnea symptoms. There are also some over-the-counter medications, such as melatonin, that can help with sleep problems, but please consult your doctor as some of these medications may have negative side effects if used over a long period of time.